health, illness, and disparities. The objectives: to define the concepts of health and wellness, explain the importance of personal decision-making and behavior changes in achieving a wellness lifestyle, differentiate health promotion and illness prevention, and discuss how nursing intervention can promote health. So first, what is health and wellness? And honestly, when I read through both of them, they're very, very similar. To be healthy or to be well, and we use those words synonymously and interchangeably a lot. There's a little distinction that your text gives you in that by definition, health is, according to the World Health Organization, a state of complete physical, mental, and social well-being, not merely the absence of disease. It's looking at the whole package of being healthy. So it's not just not having the flu or not having diabetes. It's being physically able to accomplish activities of daily living. It's physical fitness, it's mental health, the ability to think and reason appropriately, being socially engaged and being well in that arena. Those are healthy. People will say sometimes, oh, she's just not healthy, or she doesn't have a healthy outlook. It's more than just the disease itself. It's the whole package. And each person would define their health based on their values and beliefs. And that makes it a little more subjective. I may say to you that I'm healthy and realize that I'm a little overweight. That still makes me healthy and well. I don't have anything going on. Maybe I wish to be different, more healthy, but basically physically fit and mentally sound and socially engaged are all attributes. Health is a passive state, according to one of our references, whereas wellness is active, that working on being healthy and that commitment and engagement in the process. And again, not necessarily dependent on health, that complete package, but a state of well-being. So there's kind of an obscurity here that makes it a little challenging. And yet this concrete idea of being without disease, but also being able to function fully, that kind of helps me with it a little bit. Disease, on the other hand, is defined as a pathological change in the structure or function of the body. So we could take this idea of having the flu, that's the disease, but the illness is the response to the disease. So if you have the flu, then maybe there's fever and nausea or loss of appetite, weakness. Those are the responses. The illness, then, for most people with the flu, that would be acute. It's something that happens, it runs its course and goes away. So that it's an acute illness as compared to something chronic like diabetes. It's going to be there forever and something that someone has to deal with. And so just some words and ideas that we'll continue to work with. Another thing that I wanted us to be aware of before we come to class so that we can work with some of these ideas is health disparities. This is so important to recognize and understand in our society, and that is, according to Healthy People 2020, which again, if you'll remember, is that federal initiative to move our individuals, communities, our society, our country towards health, defined an issue that is real and before us, and that is disparities. And the definition of a health disparity, according to Healthy People, is that it's a particular type of health difference that's closely linked with social, economic, and or environmental disadvantage. So when we're thinking about disparities, it could range from all sorts of things, including differences in care for racial and ethnic groups, gender, male and female differences in treatment, poverty, rich versus poor, age, young versus the elderly and middle age, mental health. And we've heard so much about that recently in the news, and the care and the disparities for those that need the chronic care when there's mental illness, education, differences, people with disabilities, differences for people with sexual orientations, health insurance, the haves and the have-nots when it comes to getting treatment and care, and even then access to care. All of those things play out. One of the examples that they gave us in the book, and is certainly true, and that's racial and ethnic minorities have a higher incidence of obesity, cancer, diabetes, and AIDS. So one of the roles for nurses is, and healthcare providers in general, people, society, should be, how can we shrink this gap for this idea of healthcare disparities, so that there are less and less of them, but know that they exist. And again, look at our biases and our assumptions about some of these issues that we see, so that we can be more effective. I wanted to show you Maslow's hierarchy of needs. This is the needs theory, and it's the theory that we will operate from in our nursing program. It's kind of an idea of simple to complex, but more specifically, it's this idea of physiological needs take precedent over psychosocial needs. In other words, if you came to the ER and you're hemorrhaging, when you come in, we're not going to ask if you can pay. In fact, it's illegal. We're going to take care of the hemorrhaging before we take care of the psychosocial need and the worries about, can I afford this, and what about my family and so forth. We got to take care of priority needs. Physiological needs, just as a reminder, are first and foremost air. Got to have air to live. Got to have blood, circulation, circulating blood to circulate that oxygen. Got to have water, hydration, nutrition, the ability for toileting. All of those things are foundational to our physiological survival. And so Maslow's will be referred to a lot, and we'll keep revisiting this theory, but I just wanted you to know it, see it, and keep it in mind as we apply it throughout the program. And then finally, we need to really look at this idea as we begin to look at our caregiving, and that is the difference between health promotion and illness prevention. Illness prevention sometimes gets packaged with the idea of health protection. How can we protect our health or prevent illness? And so there you have those two. So as you read, and as you were reading, what is the difference between health promotion and illness prevention? I mean, if walking is so important and you walk, and if you eat balanced meals, what's the difference in that of promoting your health and preventing illness? It has to do with why you're doing it. If you have no particular illness and you're doing it for your own benefit, then that is considered promotion. But if there's some illness that you're wanting specifically to prevent, then again, that has to do with prevention. So it looks like this, basically. Health promotion is not disease-oriented. It's motivated by personal, positive approach to wellness. It's something you want to do to stay in general well. It seeks to expand the potential for health. Whereas illness prevention is doing something specifically to prevent becoming ill. It's motivated to avoid illness or injury, and the things that would maybe cause someone to not be well. So when we're looking at that, there's actually a hierarchy of levels of promotion and prevention of care. And that is, there's primary promotion and prevention of promotion of healthcare, prevention of illness. Gets a little tricky, and that's things that we do and understand will keep us healthy. Lose weight, diet, exercise, reduce alcohol, avoid illicit drugs, wear seatbelts, get immunizations, water treatment, good clean water, safer sex, effective parenting. All of those things are going to promote health, prevent illness. The secondary level of health promotion and illness prevention is doing things like screenings, getting blood pressure checked, getting your lab work done, checking for skin cancers, pap smears, mammograms, testicular exams, family counseling. All of those things are in the secondary realm to screen and get early detection to promote health or prevent illness. And then the tertiary level of care is treatment after an illness diagnosis. So giving medication, therapy, surgeries, rehab, physical therapy, all of those things are included in the idea of health promotion and illness prevention. So have an understanding of what those are, because we're going to work with those and see if we can recognize when someone, which level of care is being attended to. And I want you to not skip over or not take for granted this idea of Healthy People 2020. It's going to be throughout our readings all semester. And I want you to look at it and pay attention to what Healthy People is proposing to help our society. And the foundation of Healthy People is based simply on this. If people are healthy and live in healthy communities, then communities will be healthy, and therefore they'll be healthy people. That's the reverse. So healthy people live in healthy communities. That's their basis. So if people will be healthy, communities will be healthy. If communities are healthy, people will be healthy. So if that's the foundation, how then can we accomplish that? And they're going to propose throughout our program, throughout this literature, we're going to see that Healthy People is going to encourage and propose dental hygiene, for example, a number of different things that can be done to help people be healthy. And so we want to keep those things in mind. Excuse me. With health promotion and illness prevention. So know the difference, have some ideas of what's primary, secondary, and tertiary care, and we're going to apply that to a case scenario when you come to class.